Thank you, Dean Williams and Dean Saldana, for just really stimulating and amazing presentations. And I know has provoked a lot of thought for me personally, certainly, but for our audience as well. We have a couple of questions that I thought I'd just start off the bat sharing and getting both of your thoughts on. One of the tensions that is faced when we talk about a concept like well-being amongst clinicians, and I think I'm going to expand the conversation to all clinicians and clinician trainees, as we have a very interprofessional audience here. How do we protect time? Whether and whose responsibility is to protect time for these skills development? That's been one of the rate limiting steps that have been engaged in. One of our participants wrote that in their study that they did in resident physicians at the Brigham, that they would want to participate but could not find protected time to do it. So Dean Williams, I'll invite you to ask, and then I know Dean Saldana has thought about this as well as from a curricular perspective.
Sure. Thank you. First of all, it's really wonderful to have this conversation and to listen to Dean Saldana's remarks. Very informative, and I think the answer is embedded in his remarks. And I'll start by saying it's going to be the responsibility of the institution, our schools, or our hospitals where we work, but also there has to be individual accountability and understanding and appreciation that building resilience requires time, requires having an agenda, a personal agenda that is directed to promoting self-care and prioritizing self-care. And so the answer is it's all of our responsibility. Individually, we have to prioritize our wellness. And then it can't just be left to the individual. There must be institutional commitment and resources put into place to support self-care. And so that might look like really reevaluating scheduling practices. It might look like organizations listening and doing the things Dean Saldana described, listening to our stakeholders, listening to our students, our residents, and our clinicians, and hearing where the barriers are, the pain points are, and using data, using evidence to then inform how we make system changes. Mm-hmm. So the answer is really, it's all of our responsibility.
Dean Saldana, your thoughts?
Thanks again for the invitation to be here today, Darshan. I think I will echo a lot of what Dean Williams said, and I may highlight one thing. I think it is very important to set aside the time, but that doesn't mean that time will be used. So we need to change the culture. The example will be if you're a trainee as a resident, and I know at Brigham and Women's Hospital, we have something called the humanistic curriculum, where it's set aside from 12 to 1. It's set aside, it's there could be a wonderful curriculum, but if you have an admission and that your resident is giving you a little pressure, you can't go to humanistic curriculum today, you need to admit this patient from the emergency department, all the curriculum, the time that's set aside isn't going to help. So there really has to be an accountability and a culture shift so that it really trickles down from the CEO all the way down to the trainees on the front line, that this is important. And by giving it resources either through time or through financial support, I think that's where you tell your trainees, your faculty that that is important. So I totally agree that it has to be really structured in by folks who have the authority to schedule and put curricula together, just like you helped us do for the medical school. But then in more complex environments that are not as controlled as a medical school classroom, that the culture has to sort of seep in all the way down to everyone, so it's truly practiced.
That's great. Yeah, I guess it leads to me really thinking about a follow-up question that one of our attendees wrote, is that in some ways, do we need to wait for our students to become the leaders so that they can become the agents of change, or is there something that can happen now? So,
Yeah,
Dean Williams, yeah.
we can't wait.
Yeah.
And I think there's evidence that we're not, back on our heels. But culture change, and we both used the term and the aspiration very well. Culture change takes time because changing human behavior is one of the most difficult things.
Mm-hmm.
But there's good evidence that changes are being implemented and they are having effect. Having chief wellness, leaders, setting up some of the programs that you just heard about are evidence of change. Now,
Mm-hmm.
the degree to which the change is happening will take time.
Mm-hmm.
So we can't wait. We're not waiting. The fact that we're raising awareness, the fact that we are asking for feedback as we implement new practices to enhance and support wellness are all good things. And it is a process that will take time. In a lot of ways, there are a series of natural experiments that are happening. What really works well, what is working on the margins, these are, we're learning as we go along. It's a dynamic evolutionary process. But I'm optimistic. I'm a strategic optimist at heart. And what I am seeing is increased investment, increased awareness, destigmatization around talking about one's vulnerability and need for self-care. And that tells me we're not waiting. We can't wait. We shouldn't wait. But we still need to learn and implement, iterate, and improve as we go along.
I just want to highlight what Dean Williams just said and that dynamic evolutionary process. I think that that's what has to happen. And we need to have patience. We need to not be afraid of failure, and we need to not give up. A small example, Darshan, is the partnership that we served on. That for those of you who may not know, Darshan has really been a leader for us at the medical school in developing curricular aspects to wellness and well-being. But I think the first time we did it, we didn't get it right. But at least we had something, and it was there, and it showed that the medical school felt that it was important enough. And we didn't get it quite right, but we felt, okay, we didn't get it quite right. Let's keep going, and you didn't give up with us. So I think that we just have. I think we have to try. We have to start things that won't be perfect. Yes, will it be better when our current trainees are the leaders and they've hopefully been influenced by the importance of wellness and well-being? I think it will be better, but I think we have to try now.
Yeah, no, thank you. Thank you for saying that. Actually, what's remarkable, but just even the journey at Harvard Medical School has been that students, even though they were very critical, I remember having the focus group as you had invited. Let's just say they actually wanted we don't want to eliminate. Just here's some new ways of thinking about it, which was both eye-opening. That just getting that sort of feedback was wonderful to see that they really do want it. It's not that, and I think it was exciting for me as a faculty member to learn from them of how to make things better. What can we change, and what can we, because they are certainly important partners. And again, I will just say for our listening audience, we will have an opportunity to engage with a couple of students in the second half of the afternoon, so we could get their perspective on a little bit on that as well. I'm struck, Dean Williams, by just something that you said. It made me think about, have we learned lessons, or are there lessons that we learned from other industries? I know you've had a lot of dialogues recently with leaders in other industries or in other when in ways that they may have thought about well-being. And I'm curious if you, in your dialogues with other leaders, have encountered lessons that maybe we should think about more concretely.
Well, I've been laser focused on the issue around physicians, the stigma that still remains around self-reporting or state boards having requirement for physical and mental health diagnoses and treatments. And I think back to how the aviation industry went through that process and, destigmatized pilots reporting physical and mental health issues, and did it in a proactive and humane way that brought forward vulnerabilities and managed those vulnerabilities in a non-punitive, career-threatening way. I think there are lessons that we can learn as we go through this painful period of seeing our healthcare providers go through this extraordinary strain. I mean, frontline workers are under a lot of stress and strain well before COVID. And when you add that on, it really does bring a burden onto a group of care providers with already constrained surge capacity. And so we have to really look outside of the medical space and see where others have had to manage vulnerabilities in ways that's not punitive and is not a barrier to seeking help and care and building the resilience.
Right. Yeah, no, it's important to, I think one of the things, again, I've had the opportunity to also work in some of the other healthcare disciplines as both this phenomenon of well-being and burnout is across multiple healthcare disciplines, including nursing, and now we're studying it more in other disciplines like occupational therapy, physical therapy, and part of this has been brought forth in just through the COVID pandemic. I'm curious as to your thoughts. Do you feel that the COVID pandemic has brought forth newer issues that we hadn't thought about as we thought about well-being, or is there sort of it was just brought to surface what was already there? Or I mean, and obviously you may say both. So
I think it's both. When in January, when we started to see what an epidemic was happening in Wuhan and was likely to unfold across the world, I couldn't help but remember the 2014-2016 Ebola outbreak in West Africa, and couldn't help but reflect on the statistics of the healthcare workforce really got hammered, right? High fatality rates, high morbidity rates, and subsequent to the outbreak, very high attrition of skilled healthcare providers across the spectrum leaving the workforce. And this was happening in parts of the world where there's already too low a per capita population of these skilled healthcare providers. And so that for me was a wake-up call that as COVID started to spread, what we're going to see is an amplification of the strain on the global workforce, healthcare workforce. What's unfolded is even worse than an Ebola outbreak, which was sort of contained, right? This is an enduring, longer crisis on the workforce with the waves that we're experiencing. And for me, it highlights the real importance of investing in wellness and building resilience so that we have that surge capacity and that we intentionally address the attrition challenges that we were facing well before COVID. The other thing I'll say is COVID helps bring everybody's attention, not just those of us in the public health and biomedical and healthcare space, but it brings everybody's attention to just how fundamentally important the healthcare workforce is. And I would say it's the paid healthcare workforce, but also the unpaid caregivers that we're also now acutely aware of the importance of their contributions to our health and wellness on a global scale. I hope I've answered the question.
No, this is that. Yeah, no, I think you shown a new light. I mean, again, the unpaid caregivers is a huge. I mean, people. I can say that. I mean, even just parenting as a parent of a young daughter, like it's a new definition of well-being. I'm streaming to you from my home, and my daughter could be upstairs on Zoom and just thinking, okay, how am I going to work and also take care of family and balance all of that at the same time. So
this has forced us to be empathetic, right? This has forced us to recognize that, all of us have to invest in building the resilience required to have that surge capacity we all need to care for each other.
Great.
And Darshan,
yeah, Fidencio. Yeah,
interesting. I think that I think it's uncovered a lot of what was just under the surface that we didn't realize. But at the same time, I think it's offered, interestingly, some solutions when it comes to well-being. I alluded, and folks allude to the dual pandemic of COVID-19 and institutional racism. Sometimes I don't like to call it a dual pandemic because it's not new, but it's maybe we're realizing that we've actually been dealing with this pandemic for the last 400 years, and it's come to a surface. But I think just the focus on the dual pandemics this year has uncovered a lot. It's uncovered, as we've seen in the New York Times and other publications, that the difference in socioeconomic status and students going out on Zoom, and it happens in Harvard Medical School. Because we take students from all backgrounds, it has strained students even in the LGBTQ community that maybe aren't fully out at home. And it sort of brought that to the surface as well. Our Vivek Murthy, our former Surgeon General, has talked about loneliness, and I think we've heard a lot about that from our students. Our vulnerable populations, Lash said we can't be business as usual, and before these atrocities were broadcast across the globe, there were atrocities that weren't broadcast, and it wasn't business as usual for many of our students every day, and we weren't just cognizant of that. So I think that it's really made us aware of things that were below the surface.
But
on the positive side, I think what you mentioned is that you said you're home and your daughter's upstairs. Folks are working from home. There's flexibility in taking meetings. To use our microcosm, we're not asking faculty to travel 30 minutes from their hospital site to the medical school. You being at Mass General Hospital, which is anywhere from a 12-minute to a 2-hour drive, depending on the traffic. But I think that as Ed Hunter, our Dean for Medical Education, says, we have to see what has worked well during COVID. From a curricular standpoint, that we could do that, but what has worked well for well-being? I think as a faculty member, do we really need to have you waste an hour of your time in a car to commute where Zoom is there? Or, could you take a meeting driving your child to soccer or what have you? So I think we really need to say, from a well-being standpoint, which I don't think many people are taking a look at it, but what worked well for students, trainees, and faculty, and how can we take advantage of that?
That's a really good point. I just want to give an example. Yesterday, I had a one-on-one meeting with a junior faculty member I hadn't seen for 3 months. And, we're all looking at each other through the Zoom platform. And he starts the meeting by saying, there are silver linings. And he goes on and he lists a father of 2 youngsters at home. He's spending more time with his kids. He is exercising in ways he'd never exercised in the last 5 years. So, he detailed how he takes an afternoon run. He's learning to play the sitar, using an app and connecting with people. And I thought, how lovely is that? And he's still writing and publishing. He's still mentoring other junior faculty members and fellows. And he's bright and creative, and what he's done is use the commuting time to invest in himself and in his family. And his science has gotten better, and his teaching has gotten better. That was just, for me, a one-on-one faculty conversation yesterday that is perfect illustration of what you just, shared.
Yeah, no, thank you. Fidencio brought up something that was just led into just, I wanted to get a bit more deeper perspective. What do you feel are the structural effects of racism, and how do they, in terms of affecting the well-being of healthcare providers and trainees from communities of color and marginalized populations? Just to think of that a bit more deeply, is there something uniquely? How do we need to both address their needs, and how do we train faculty or people who are in the position of saying, okay, we want to create safe spaces for people to invest in their own well-being when we take that into not just taking into account, but really embracing all of that as part of well-being as well. So Dean Fidencio, maybe you can start, and then Dean Williams.
Sure. I'm sort of looking over at Dean Williams to see if she has till 5 o'clock tonight to kind of deeper into the subject. I think just a couple of points. I think that this is a repeated trauma, and maybe an approach that is coming out at the medical school for different reasons, but a trauma-informed care approach to caring for our trainees. We're trying to use trauma-informed care principles to care for our students and advising. But I think that we have to be cognizant of that this is not one big event that we'll do a town hall and we will get a group together and do a book club and it's over. I think that this, as we have seen, really, even just in the last week, every day there's a new repeated trauma. Imagine over the course of months and years. So I think it's just a recognition that it really exists and has to be addressed in a very unique way.
Yeah, I think Dean Saldana's got it right. It is to be viewed as trauma. And to think about addressing it through the framing and lens of trauma-informed care. But what is different, since George Floyd, is that there are more people aware and wanting to become more aware and cognizant of the everyday individual racism that Black and brown people experience. But also, I think, in addition to that, is the appreciation of what systemic institutionalized racism means. There is a stronger interest and commitment in understanding that, and understanding that is different and will require different solutions than the individual racism that we experience. And both of them are problems, and both of them bring trauma. But the commitment to understanding both of these forms of trauma and recognizing that being a bystander is insufficient, and that the solutions can't be coming only from Black and brown people who are victims of this are important. There's also the recognition that medical students and residents and others face these microaggressions and these traumatic experiences every day. And we have to give them space to talk about this without their own worry that they're the cause of the problem, that they're the troublemakers or they are too sensitive. So we have to be very intentional in creating safe spaces for people to bring forward what these experiences are, to reflect on them, and to build, again, another source of resilience, how people can gracefully manage this. I'm not a care provider, but it must be a unique experience when a young physician is being faced with overtly racist behavior by a person they're about to give care to. And I would say that, being mentored and being guided by others like them, this is where having a diverse faculty will be important, is going to be an important and essential part of the training experience for care providers.
And Darshan, to add one thing, I think it's important that as far as that aspect of things, that we take some action immediately. I think what many are frustrated with is there's been a good deal of talk, a recognition and identification, but not enough action. And, as Dean Williams said, the identification that this is on the institutional level, it's up to our institutions to take action. Even if there's small victories, I think that will go a long way for individuals to say, okay, at least something's moving forward. It may not be the ideal, but we're at least headed in the right direction.
So this is great. So I'm going to just slightly pivot to an area where maybe to just ask you to explore a bit more, as our audience represents a wide variety of professional backgrounds, from the integrative medicine disciplines like massage therapy, acupuncture, chiropractic care. Are there, and just from your own, either your own personal or professional experience or interactions, how do you see the sort of the integrative medicine community being a part of this clinician well-being effort, broadly speaking, and really requiring, again, many people who are in leadership in healthcare systems to embrace that there may be possibilities that can be offered through some of the wisdom or evidence that is offered in some of these other practices and providers. So whoever would like to start.
I will say that I have been trying to be more thoughtful in my use of words and language to describe this large heterogeneous group.
Mm-hmm.
And I don't always get it right. But I think it's really important that we work on that we use language that actually captures that heterogeneity of the healthcare workforce that is really quite heterogeneous, and that we see them, hear them, and value all of them. So I think there's work that we have to do there. We talk about team science on my end of the spectrum all the time, but I think we all know that it requires a team of experts with lots of different specialized skills for care management and wellness management. And I think we have to sort of, this is another form of culture change. I think we have to sort of see, celebrate, appreciate, empower, and enable that full spectrum of providers out there. It's so critical if we really want to, achieve a healthcare system that is wellness as well as healthcare. So that would be nurses, midwives, social workers, therapists. All of them have to be seen as part of a fundamentally important team approach to health and wellness. I don't have the language right, though. I get it wrong all the time because we tend to focus on doctors and nurses, and we forget midwives and doulas and others, that we should be more inclusive.
Okay. No, thank you. Fidencio.
So I think, Darshan, it's important to reframe what well-being is. And we'll take the massage therapist as an example. So you, as a massage therapist, you offer your services. And I think we made the mistake of not framing things appropriately and say, well, you're telling me that racism will go away. I'm not going to care about my board exams if I go get this 15-minute massage. And that's totally incorrect. I think reframing that there have to be systemic changes, but that it's okay to take care of yourself. There are tools that you can use to take care of yourself. A massage can be very therapeutic, and in that moment, allow you to enter a different space. So I think that's the one thing in reframing that, we're not telling you that, yoga or massage or any of these things is going to solve it. This is just a tool. But it's important that you have a whole system so that this is not the only thing that you're presenting to your constituents, that these are the many tools that you have. They're all very important, and that it's okay to take care of yourself. And, I think I would pose the question back to you, Darshan, even though you're a moderator. I think, again, we haven't gotten it completely right, but it sort of tells me that maybe we should write a little bit more about this to communicate to folks. Maybe you can talk a little bit about what we've done at HMS, where you have invited all of these folks from different parts and expose them to students, again, as part of our tools for well-being. So it is, raising your hand to the deans for students or the CEO saying, I'm here to be part of your toolkit for your trainees or for your faculty.
No, it was interesting. I'll just give just a brief answer to what you just posed, which is that when we ran our most recent iteration of the curriculum, the most subscribed, this was right after we went into sort of a virtual Zoom-based, primarily Zoom-based teaching environment, was our chiropractic care provider, Dr. Mal Kowalski, who's will be speaking later on this afternoon. And he just on how to take care of your back when you're on the computer all day, which is something that we don't think is part of our well-being, but yet it was such a well appreciated, and who would have thought that we would have had a chiropractic care provider give a very important lecture to students at Harvard Medical School. I could never have imagined that, and here we've arrived, and it was really one of the most celebrated, I think, sort of experiential presentations that also had a nice evidence base and also clinical wisdom that supported that. So yeah,
that's a perfect example. And I think about what we learn about breathing. I mean, something fundamental is breathing. And to have an exercise wellness coach remind you about your posture, but also nose breathing.
Right. Yeah, that's great. Yeah, no, you speak right to my heart as we think about mind-body practices and sort of the fundamental role of breathing. I want to just finish up because I want to respect your time and just generosity of just being with us, but just maybe give some, as we are on sort of the brink of this election, just to think about what are some policy implications that we should collectively as a group be looking forward to. I imagine you've had some thoughts or discussions in seeing things on a broader sort of the macrocosm. Where are our opportunities and where should we be advocating for as we think about well-being of the healthcare force?
I'm eager to continue my work with the Lorna Breen Family Foundation on pushing through the bill for Congress to really work on that at a policy level. I think if we can work with our medical boards and deal with the licensure issue, that will be big. That's taking public health practice to scale through policy. I think the other thing that I think about is we're fortunate in New England, at Harvard, Massachusetts, to have this kind of progressive approach. We have to spread the word and we have to advocate for making this type of awareness and type of commitment be more universal, particularly in hard-hit communities in our Sunbelt area and others.
I completely agree. I think taking best practices, even focusing on the trainee level, to the large organizations for medical schools like the AAMC or for nursing or for PAs or whatever health profession school, to really look hard at trying to have a national statement on wellness, well-being, resilience. As many, I'm most familiar with the medical school organizations, but many have taken a stance on that. And I think that would be a wonderful place to start, because then there's that accountability that really comes from the top that can then be applied at the local level.
Well, I just want to, first of all, thank both of you, Dean Williams, Dean Saldana, for just an amazing presentation. I think our audience, if you can see the chat board, it has been flurrying with comments, and my apologies to all of that we haven't been able to address. As this is meant to really stimulate, and we see that what you have done has really stimulated tremendous discussion and dialogue, and I encourage, again, our listening audience to continue this dialogue. I think there's tremendous work ahead and tremendous opportunity, as both of our leaders here have pointed out, and tremendous room for creativity and approach. Again, thank you so much for your wisdom, and thank you so much for taking this time to be with us, hoping that we can reach back to you and have, as this sort of community gets galvanized, that we can also propose some new ideas and solutions and possibilities through research, education, and obviously sort of the transmission of knowledge to the workforce.